Welcome to Presenteeism, Psychological Health and Workplace Performance During the Pandemic. My name is Yusra Benjeloun, Administrative Coordinator and Project Manager with the Work Wellness Institute, and I'll be co-moderating today's webinar. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to WWI. We thank our program partners, Education Advisory Committee, and speakers who contribute to this webinar series. We would also like to thank our academic team and our 9 founding partner organizations in the Harnessing Talent project, including the Canadian Mental Health Association, CMHA, represented by Jordan Friesen, who is with us today.
For those of you that don't know Caroline, Caroline Biron is a full professor in the Department of Management of the Faculty of Business Administration at Laval University. She's the director of the Center of Expertise in Occupational Health and Safety Management and a member of the VITAM Sustainable Health Research Center. Her work on presenteeism, preventative interventions in psychological health and stress in the workplace, has been the subject of numerous scientific and professional publications.
And my first conclusion is that to treat psychological distress, we must not only treat the individual, we must also treat the company and take care of work and work organization. This is a conclusion that I've been pretty much saying for the past 20 years, ever since I've been involved in this field. And yet I still meet with employers who think that psychological distress problems are something that relies on the individual's shoulders, something to take care of yourself. If you know you're stressed, if you have a stressful job, go for a jog, it'll help you, do some meditation. And we're arguing that yes, it is the individual's responsibility, but there's also something at the organizational level, and we'll go into depth with this idea in mind. My second conclusion is that we need to create sustainable quality jobs. And during the pandemic now, more than ever, don't wait until later. I think psychological health is an issue that we're very likely to, I think it's going to be like all these green issues, becoming green. I think there's perhaps a chance that we're going to be postponing this until later, and we shouldn't, because to me it's part of the solution for a better work organization, better health, and better productivity for the whole society. And this is a shared responsibility between individuals, groups, leaders, and organizations. So it does the igloo model that I owe to my colleague Karina Nielsen. I'm going to start by looking at schools of thoughts to define presenteeism. Now, there's the European school, which defines presenteeism as the behavior of working while ill. And this is the definition I will adopt throughout this presentation. So working while you're ill. And therefore, we focus our attention on what's motivating this decision process. Like, why do you work from home? Why do you work while ill? I mean, okay. Here's the prevalence in Quebec, in the Quebec labor force in 2008. This is the last data we have of a survey that was representative of the Quebec working population, active population. So working while ill, short-term presenteeism. So that is people working between 1 and 9 days a year while ill. So short-term presenteeism, 40% of the Quebec workers, whereas doing 10 days or more during the last year of presenteeism, we had nearly 15%. So we're going to be looking at these statistics as over the past 7 days during lockdown. Now, in terms of causes of presenteeism, these causes can be quite, there's a wide range of causes. So there's the rather environmental, something quite broad, the economics, politics, so and also at the organizational level. So for example, the absenteeism policies will have a strong impact on whether you show up at work while ill. So if you have a strict absenteeism policy, if you have somebody calling you at home saying, how come you're not at work, and you have very strict policies, you'll tend to show up more despite your illness. Labor shortages, so this is something that's been quite all over the news during the crisis, where people with they were still ill with COVID-19 and they had to go back to work after 7 or 8 days because of labor shortages, especially in elderly care centers. So this is one factor that can certainly explain why people would show up at work ill. Job insecurity, so afraid to lose your job. Work-related factors such as having too much work to do, simply just too much work to do, and you think, I'll just work. It doesn't matter whether I have a cold or whatever your health problem, you think I'll just get rid of my workload. It's impossible to get a replacement. Perhaps there's a lack of support from a supervisor and someone would be afraid of negative repercussions. We know that having clients or patients or employees or students, anyone who rely on you to do your job, this will tend to increase presenteeism because you don't want to be letting these people down. Also, the fear of letting colleagues down is a factor that will impact presenteeism, and the team culture. So if you're in a team where everyone shows up through, despite their illness, then you'll tend to do the same because this is what's accepted. This is what's legitimate. It's a legitimate culture of presenteeism. The manager will also have a strong impact. If the manager shows up at work despite the state of illness, then this will influence the rest of the team. We asked the question how they spent their time working, and what we have over the last 7 days before the survey was half of the time spent teleworking as opposed to working in the workplace. So about half and half, whereas during normal times or before the pandemic, this would have been more like 5 hours of telework with 33 hours in the workplace. If you look at the total, so we work in average 2 hours less than we would in normal times, which is understandable considering that many of us are working with children and working from home, so 2 hours less. And we had 38% who were doing a ratio of 80%, at least 80% in teleworking and full-time. So 38% fully teleworking and full-time. I'm now going to look at what psychological distress is, and I'm going to explain what the indicator is. This is from my colleagues who were kind enough to give me those 2 slides, colleagues at the Institut National de Santé Publique du Québec. So we used the Kessler 6 questions, and we asked, in a past month, how often have you felt nervous, hopeless, worthless, so depressed that nothing could cheer you up? Everything was an effort, restless or fidgety. And you answer this on the scale of 0 to 4, and it'll give you a score between 0 and 24. And this will give you your level of psychological distress. Now, you can complete that and see if it's above 7, then it would be considered as high psychological distress, which means you need to be vigilant, you need to be aware there's something going on. So above 7 would be perhaps to your mental health saying that you're sort of feverish, okay? The same, if you were to be feverish mentally, that's kind of what it says. If it's above 13, then there's a good possibility that there's something more serious, that you probably would need some sort of treatment. Above 13 is something more worrying. Above 7, a score above 7 is a threshold that's recognized in the literature for its ability to predict the probability of developing something more serious. And it corresponds to the value that was used in 2008 in the Quebec Population Health Survey. And that's what was used in 2014-15 as a threshold. So I'm going to use the same threshold as the Quebec Population Health Survey and with my sample. So we're using this threshold of 7, okay? So a score above 7. And what we have in this sample is quite a strong or a marked increase compared to the previous 2014 and 15 levels. So both for male and female, male went from 24% of high psychological distress to 41 in the current sample. And female went from 33% reporting high levels of psychological distress to nearly 56% in the current sample, with an average of 48% in my sample, 48% of male and female. In terms of employment, employment sector, we also have quite worrying levels in terms of the sector health and social services. Healthcare workers, 61% of them report a high level of psychological distress. I think here this slide tells us pretty much everyone is affected, whether you're in this essential services, in public administration, perhaps a little less in private, but well, health and social services, definitely something here that's been worrying, and that's something that's been decried and mentioned by several people and researchers for several years now in Quebec. We ask whether there's a difference between people who are at work, physically present at work, as opposed to teleworking, and we found no difference. So you can actually do some presenteeism even though you're sick and teleworking. So this is something that I don't think has been looked at much in the literature, but yes, you can do presenteeism and do some teleworking. Now, if we look at the typology of presenteeism, what we find is there's 32% of the Quebec workers in my sample who reported functional presenteeism. So they're quite performant and they're in a rather good health, even though they're not fully healthy, and they're declaring presenteeism. So in other words, this is my 37%, okay? I look at the 37% who've been reporting presenteeism, and I'm breaking them down according to the type of presenteeism they're doing. So 32 are doing functional, 30 are doing dysfunctional, and we got 22 and 16 in therapeutic and overachieving presenteeism. And we're going to be following these participants over time. We're going to follow the evolution. My hypothesis is that good working conditions will influence what type of presenteeism you're doing here. I think there's something perhaps individual that has to be done, like you need to be aware of where you're positioned in this typology. Like if you're, for example, teleworking with kids, with full performance, and you've got your good physical and mental health, and you've managed to keep your house healthy and get rid of all your laundry and do everything perfectly, like are you in the overachieving? Like is your health affected, or are you really healthy? And therefore you're probably functional. So perhaps individually there's a reflection to have as to where we're positioning ourselves in here, and being aware of when it's time to perhaps take a sick day, as opposed to, no, I'm still functional. So individually there's a reflection to have, and organizationally we need to look at what are the working conditions influencing these types. And this is what we'll be doing over the next few months. We'll have 3 more waves of this survey, and we want to look at how people will be moving through the quadrants and establish some trajectories